Peptides have become very popular. Some are manufactured by big pharma, and some are made by small compounding pharmacies. But what do you need to know about them, and what do you have to watch for? Hi, this is Dr. Navarra. I have been caring for patients for over 25 years. My practice is in Newburyport, Massachusetts. Peptides are short chains of two or more amino acids. More than 7,000 naturally occurring peptides have been identified. They help cells communicate and regulate many biological functions, including hormone production, tissue repair and healing, immune function, metabolism, muscle growth and recovery, appetite regulation, sleep, and cognitive function. People often use peptides to try to improve body composition, support muscle growth, enhance recovery from exercise or injury, improve sleep quality, support healthy aging, aid weight loss, and optimize metabolic health. The first peptide produced and used was insulin in the 1920s. Many peptides are now produced by the pharmaceutical companies, including the famous Semaglutide, Tirzepatide, Lantus insulin, and Lupron, to mention a few. We will, however, focus on peptides manufactured by compounding pharmacies and not by the pharmaceutical industry. A huge concern here is product quality. We need to make sure that we only use products manufactured by licensed 503A or 503B compounding pharmacies that are CGMP certified good manufacturing process. This ensures that you are getting more than 98% purity 100% of the time. Problems with using peptides purchased from the internet are many, with some causing serious bodily harm. The controversy over peptides in the last few years was primarily about compounding, safety, quality control, and lack of clinical evidence. Around 2023, the FDA placed more than a dozen peptides into a category of substances that raised significant safety concerns for compounding pharmacies, although they had been manufactured and successfully used for years. This effectively limited the ability of licensed pharmacies to legally compound many of these peptides. Because demand remained high, many people began purchasing peptides labeled research use only, not for human consumption, from online vendors. This created another concern. Products sold outside regulated pharmacy channels may have inaccurate dosing, contamination, or incorrect ingredients. I recommend you stay away from such products. In 2026, the regulatory environment appears to be shifting. The FDA is reviewing several peptides again to determine whether they should be eligible for compounding under specific circumstances. Even if some peptides are allowed to be compounded again, they would still not be FDA-approved drugs, unless they go through the formal drug approval process, which is unlikely to happen. This is called off-label use. This is not uncommon, as in regular medical practice, doctors prescribe off-label medications about 20% of the time. Let's review a few popular peptides. Some are available, and some hopefully will be available soon. For weight loss and metabolic health, Semaglutide, GLP-1, and Tirzepatide, GLP-1 plus GIP. These products can be made by both big pharma and compounding pharmacies. They are FDA-approved for diabetes and weight loss. They are administered subcutaneously weekly. Some GLP-1s are now available orally. They cannot be used if you have a history of pancreatitis, medullary thyroid carcinoma, multiple endocrine neoplasia type 2, and caution if you have retinopathy. It is important to exercise and eat enough protein to minimize the loss of muscle and maximize the loss of fat. Growth hormone secretagogues. They promote secretion of GH, growth hormone, which goes down as we age. They help with body composition, increasing muscle mass, recovery, and sleep. Sermorelin is FDA approved and it is given at 200 to 400 micrograms sub-Q daily at bedtime, Monday to Friday, and off Saturday and Sunday. Other similar products are Ipamorelin and CJC-1295, which are usually used in combination at around 100 to 200 micrograms sub-Q at bedtime in a similar fashion as Sermorelin. For tissue repair and recovery, BPC 157 helps with tendon and ligament injuries. The dose is 500 micrograms sub-Q or orally once or twice daily. It can be used alone or in combination with other peptides like thymosin beta-4 or TB500. BPC 157 is also used for leaky gut syndrome at 500 micrograms once or twice daily, alone or in combination with KPV 500 micrograms. BPC 157 should not be used in cases where there is evidence of or suspicion of cancer, as it promotes blood vessel formation. For immunity, Thymosin Alpha-1. It's good for immune support and chronic infections. The dose is 1.5 milligrams sub-Q every 3 days. The duration depends on the indication. For cognitive and anxiety support, Selank is good for anxiety, stress resilience, and cognitive support. The dose is 300 to 1,000 micrograms daily. Use as 1 to 2 nasal sprays per nostril 2 to 3 times a day for 2 weeks, then reassess. Semax is good for cognitive enhancement and focus. The dose is 100 to 300 micrograms intranasally once or twice daily for 10 to 20 days, then 1 to 2 weeks break. For sexual function, PT 141. It is good for ED in men and low libido in women. It also can give you a nice tan. The dose is 2 milligrams sub-Q 1 hour before sex. It is not recommended the use of Viagra-type medications with PT 141 due to the risk of hypertension and priapism. Finally, GHK-Cu. This is a peptide that promotes tissue repair, collagen synthesis, skin rejuvenation, hair growth, nails, and wound healing. It can be used sub-Q, orally, or topically as skin creams or foams for the scalp. The bottom line is using the appropriate peptide from a reputable source and monitored by a knowledgeable medical provider can be very beneficial. This is Dr. Navarra, and you're watching my YouTube channel, Vibrant Health and Longevity. Until next time, stay vibrant, stay strong, and keep on thriving.